like to give you an introduction to dialectical behavior therapy. So dialectical behavior therapy was created by Marsha Linehan for the purposes of working with clients who are struggling with suicidality in particular. Suicidality is often a symptom when people are experiencing intense emotional pain and they have difficulty regulating their emotions and tolerating that distress. So this can occur in individuals who have something like depression or mood disorder, or people who have borderline personality disorder. The great thing about dialectical behavior therapy is that it has been applied to many different populations and many different psychological challenges, as well as to people who have no particular diagnosable problem, but because it provides skills for everyday living, managing emotions, and interpersonal relationships, it's been shown to be effective in a lot of different settings, from inpatient to outpatient to just general school settings, as well as corporate and work training. So dialectical behavior therapy, that dialectical piece is a big word, right? And it really just means that, there are these opposing forces in the therapy. One is the acceptance skills, right? So that the ability to be mindful and tolerate negative emotions and accept things as they are. And then the other piece is change skills, which is the ability to use things like interpersonal effectiveness and emotion regulation to alter your relationships, get what you need, as well as alter your emotions so you feel less vulnerable. And so dialectical behavior therapy is influenced by Buddhism and mindfulness. And the general idea is that there's no one truth and that balance is necessary. And that is reflected in the skills as well as in its approach to relationships, which can be really helpful both for individuals and couples and families. So you can kind of think of it as basic emotional and life skills, right? And who doesn't need those? So dialectical behavior therapy has, and I've already referred to them several times, but it has 4 specific sets of skills. And then within those 4, there's 30 plus different skills that can be learned. But the 4 basic categories or buckets of skills in dialectical behavior therapy include mindfulness skills, which kind of teach you about being self-aware, less judgmental, having a little bit more intentionality about where you place your attention in life and in your relationships. So that's mindfulness. We can think of that more as on the acceptance skill side of things in dialectical behavior therapy. There's emotion regulation, which helps teach you how to decrease unpleasant emotions, how to increase positive emotions, right? So it's how to change things. This is a change skill. Distress tolerance is strategies or skills for making distress that you cannot change in the moment. So we can't change all of our emotions. It's making that distress more endurable so that the really distressing situation is not made worse by some sort of impulsive action or addictive behavior. So distress tolerance, you're getting the idea, falls under acceptance skills. And then interpersonal effectiveness skills really teach you how to approach your relationships in a way that makes it more likely that the relationship is maintained and that you're effective in asking for something or in saying no to someone and maintaining boundaries while maintaining your self-respect and a good relationship. So that goes in the change skill bucket, right? So we have, and sometimes they, are in both buckets. Emotion regulation can be both an acceptance skill at times, as well as a change skill. Okay. So in the beginning of dialectical behavior therapy, we think about what are the different problems that you have in your life, right? And we think of those as being able to be lobbed into four different possible solutions. You could solve the problem, which probably means we're going to use change skills, things like interpersonal effectiveness or emotion regulation. You can feel better about the problem. In other words, the problem doesn't change, but maybe your emotion does. Again, that's a change skill and that's emotion regulation. There's a lot of strategies in DBT for that. You can tolerate the problem. Some problems are unchangeable, right? For example, grief or a breakup, right? We can't necessarily change that problem, so we have to learn to accept and tolerate our emotions, and that's distress tolerance skills as well as mindfulness skills. Really there's a fourth option, DBT says, which is to kind of stay miserable or make it worse. And that's the only case in which you wouldn't use any DBT skills. And so the first part of DBT is to develop target behaviors. Target behaviors are things which you would like to increase or things you would like to decrease. And ideally in DBT, when you're thinking about those target behaviors, it's great if they're related to things like acceptance or change, or if they're related to things like regulating your emotions, managing your interpersonal relationships, or tolerating distressing situations. So when you're thinking about starting DBT, you want to start with target behaviors. What do I actually want to increase in my life or change in my life? Or what do I actually want to decrease in my life, do less of, for example? Thanks for listening.